Hey guys, I'm Dr. Rahul Khare. I'm the owner of Innovative Express Care, um, and I'm an emergency physician currently at Illinois Masonic, as well as have been at Northwestern downtown for 12 years. Listen, I'm here to update you on the front lines. A lot of people are asking me questions about what's going on, so we thought we'd take this opportunity to do a quick 5 to 10 minute discussion as well as of what I'm saying. I have really sad news that we've had 4 positive COVID-19 cases. They all came in this morning and they're coming in right now. And we've been testing for the last 3 or 4 days. So we were very lucky for some time, but unfortunately, COVID-19 is in our community. This is Lincoln Park, Lakeview, Northside. All the patients we have, we've gotten a hold of and let them know what's going on, and they're being quarantined. Luckily, none of them need to go to the emergency room right now. But I just want to let you know that COVID-19 is here and it's in our community, and I will talk to you about more about each one of those cases, but not all of them were in close contact with someone with a known positive. So that means a community spread, that's person-to-person spread without knowledge of having COVID-19. So just know that. First and foremost, I want to give you some statistics. Innovative Express Care has been screening and testing patients for the last 5 or 6 days. We are using telemedicine to screen patients. So if you are, and we'll talk about who that is for, but first and foremost, I want to talk about limiting exposures. I know people have been telling you this, and I am a doctor, and I am telling you, please limit your exposure to people. Your family, of course, can stay together. Your close loved ones can stay together. But if anyone who leaves your close space is at risk of getting the virus and bringing it back. And I really need you to understand that's how it works. It's pretty simple. So let's move on to what Innovative Express Care has done and what we're seeing. So we've screened over 200 people, probably about 75 people in person, 125 people via telemedicine, kind of like this, through a Skype-like atmosphere where we're not actually talking to people. Of the 200 screened, only 75 had needed COVID-19 testing. And of those 75, unfortunately, we've had 3 positives so far. The test is taking 4 to 6 days to get back. That's just how long it takes. At first it was 1 to 2 days, and obviously they're getting overwhelmed with the amount. We're sending our tests to California. We send to a private lab called Quest, and that's what we're doing right now. And by the way, I am going to open this up for questions at the end of my little presentation, so please jot them down. But I won't be looking at all my friends saying hello for right now. So here's what I want you to know. This is serious. It's spreading quickly, and you need to stay isolated. This COVID-19 situation people are talking about is not overblown. The White House has actually asked you to limit your group gatherings to 10 people or less. I encourage that. CDC is saying 50. It should be 10, at least now that we have COVID-19 in our community, it should be 10. I think 50 was fine a few days ago, 5 days ago, 7 days ago. But now is the time to really limit big exposures. And if you don't need to go out, don't go out. What does this mean? For my kids, unfortunately, it means no play dates. It's the saddest thing. I hate to tell them that. I want them to talk to their friends via FaceTime and Skype and all that stuff, but I really don't want them at this point bringing in a virus to them and therefore to me and therefore possibly to my mother and father and all the older people that are at risk. So don't go anywhere that is not essential. Stay at home. Take a walk and enjoy the nice weather today, but don't go out in groups. Go out, with your loved ones. Take a jog. That's fine to do. But big gatherings is a no-no. And yeah, we're all asking you to drastically modify our daily lives in order to curb this epidemic. The other thing I'd say to you is if you have any loved ones that are working in healthcare right now, ask them what they need. Like give them something. Like you can set things on their doorstep. You don't have to touch them or see them or anything like that, but ask them what they need if they just need anything at all. It's really important because I know my employees right now, it's a really tough time for them. They're scared. They're very anxious. The one thing that they don't really need a lot of is asking them for medical advice. You know, get it from me, get it from others, but you know, they're inundated with questions. So please, just be careful. Let's talk a little bit about the patients that are positive from Innovative. You know, as of yesterday, Illinois Masonic had one positive patient that was being discharged from the hospital, which is great news. As I mentioned before, we have 4 positives right now. So I'm just going to go through the cases so you understand what we're seeing in our community. And this is Chicago, Illinois. This is the North Side. This is Lincoln Park, Lakeview, Bucktown. This is our community. So one was a young woman in her 30s. She went to Disney World and developed flu-like symptoms. She complained of subjective fevers, which are not actual fevers taken by a thermometer, just a feeling of feeling cold and sweating and those things. We call that subjective fever. She had chills. She did test positive for COVID-19. She had a negative flu test as well. We have a 52-year-old white male who came in, had actually encountered somebody who was positive, known positive. And then he started to get fever, chills, cough, and congestion, and a mild headache, mild sore throat. We tested him, and he was positive. And then we have the one thing about this patient that I'm a little bit concerned about because of the way the CDC guidelines are, and this is just one patient, so I have to, you know, you don't do, you won't change your practice based on one patient, but I want to say this. We tested him for influenza, and he tested positive. So the thing I'm worried about is usually in our algorithm, we stop at after they have a positive flu, we actually stop. But unfortunately for him, we did send, at that point, we send a COVID-19 test, and that turned out positive as well. So it's just one thing to consider that we have two viruses coming on, and that it's a thought of, do we really stop testing because we are in flu season. Lastly, we had one more, a 47-year-old African American male who had a fever, a cough, pretty short of breath, and we actually did a chest X-ray on him. Who showed pneumonia. He was influenza negative, strep negative, and we sent his COVID testing and it turned positive. So we do know that pneumonias do come along with the COVID-19 virus in some cases, so that's important to really understand. And then we had a 26-year-old white male who his biggest complaint was this sensation of feeling like his chest was being squeezed. That's what he said to us. He did have a fever. It was subjective. He didn't take the temperature. He had a cough, but no direct exposure to anyone he knows of that has COVID-19. Unfortunately, he tested positive as well. All these 4 patients are in good condition. So it's important to know that none of them are on ventilators or anything like that. Again, this is early on, but these are some of the things we're seeing. So what can we do for you? What if you feel sick and you're worried about COVID-19 or your loved one or your friend? What are the things that we can help them with? So if you're sick, especially if you have a fever, schedule a telemedicine with us. If you go to innovativeexpresscare.com and click on the COVID link, it will tell you our telemedicine options. I think it's really important to get screened because many patients don't need absolute testing, but they need to be screened, meaning they need to talk to somebody, a provider, a doctor who can really say, you know what, you're the worried well, you probably have a virus. Do not come into Innovative, which unfortunately, you know, we have people that are positive here. So if the risk of you not having it is so low and the risk of you coming in might be a little bit high, we don't want you coming in. Right? That's the definition of over-testing, when you can get bad things when you're testing patients that do not have a condition or are very low likely to have the condition. So be careful. Only do a telemedicine with us first. And then if we deem that you are positive or that you do need further testing, then yeah, we will actually put a note in your chart. You will get a mask, and we're going to try to get you back into a room without being in the waiting room. So that's our protocol. Do not walk into an urgent care center or an ER. You're just putting yourself at risk unless you get screened via telemedicine from us, or from somebody else. We're here to help and answer any questions that you have, but it's really hard. We're having a lot of phone calls, and of course our phone lines went down, which, you know, of course it's like it feels like there's a fire everywhere around us. But if you have any questions, go to innovativeexpresscare.com and click on the COVID-19 red banner there, and that'll give us to our actual COVID site, which is innovativecorona.com or innovativecovid.com. Anyway, if you have any questions, like please ask them now. I'm going to take some, but I really do want people to stay safe. I want them to stay home. People ask me all the time, what about travel plans? The hard thing about traveling, especially on a plane, is that we don't know what's going to happen in 1 week or 2 weeks. You may be stuck in whatever place you're in for a while. If you're able to drive there, you know, you'll be able to probably get back. Gas looks like it's pretty cheap right now. We're not running out, which I'm really happy about. And no one's on the street, so I think you'll be fine. But if you're flying somewhere, imagine if some country becomes endemic, and then our country says, you know what, we don't want anyone from Costa Rica, Mexico, whatever, because they have such a significant amount of COVID-19, we're locking down our border. You have to be careful. Everybody wants to be home. I would recommend staying home, but if you have family and want to, you know, isolate yourself with them, this might be a good time. So I'll put that down. In the meantime, please give me some comments here, and I'm going to update this every day. So we're going to do live videos every day. But like I said, we have 4 positive COVID-19 testing in the last 3 days. That's Lincoln Park, Lakeview, Bucktown area. It's the north side of Chicago is what we have. We have dedicated telemedicine lines for you if you want to get screened for it. There is a cost involved. Go to our website to look at that, but it is to pay for my providers who are all doing overtime work here. And just a shout out to my providers. They're working the front line. We are gowned. We have N95 masks. We have eye protection, and we have Lysol that we're using. But in a weird way, we are running out of Lysol. We are running out of gowns. We are running out of masks. So these are real issues. The same issues that you guys are having at the grocery store and at Walmart and all those things that we're having in the medical world, as well as Lysol masks and things that you're having. So if you know anyone with who can donate some or who have more, we'd be happy to even purchase them from them. So we intend to set up a tent in our parking lot. We're getting the details finished up right now. That's where we want to do all our testing, because we know that outdoor testing decreases the amount of person-to-person contact, and it's easier to clean, and it's less person-to-person transmission of the virus. So we will be doing outdoor testing. Luckily, it's hopefully getting warmer here in Chicago to allow us to do that for 12 to even 24 hours if we need to. So please give us a comment on this Facebook Live, and we will continue to hopefully support you guys in every way we can. But do a telemedicine first, because what I don't want is for people to just walk in wanting testing, because it puts you guys at risk, especially if you don't have a high risk of having it. We are bound to the rules of medicine, which is we can only really do telemedicine with people who are in Illinois. So just know that. Unfortunately, there are other options in your state, so just look for those. That's it from here. Guys, stay safe. I know I have this smile on my face, but I am anxious. I don't like what's going on right now. I am quarantining myself outside of work. I don't have any symptoms, thank goodness, but I know that we are around it, and I will be staying at a hotel or an Airbnb for the next 2 to 4 weeks. So I will be around. If you guys need anything, please contact us using your normal methods or on Facebook if you have a question. Hopefully we can answer it on our next Facebook Live. Okay, guys, you take care. Bye-bye.